And our next subject today is sleeve gastrectomy. What is this procedure?
Sleeve gastrectomy is a procedure which is designed to help people lose weight. Surgery is often a last resort for weight loss. It is not a well-known procedure. The gastric band is a much more commonly known procedure. However, sleeve gastrectomy, which involves remodeling and removing part of the stomach, is fast becoming the most popular procedure for weight loss surgery in Australia and the world.
Who, in terms of patients, would most qualify for this type of procedure?
The patients that qualify for weight loss surgery are patients that have usually been struggling with their body weight over a number of years. Surgery is often a last resort for these people. Often patients who have tried various diets and exercise, they lose some weight, but often the weight comes back on again, like a yo-yo effect. And sleeve gastrectomy is a surgical option which we often discuss with patients as a surgical solution to their weight problems.
Are there any possible complications associated with this type of surgery?
With any type of surgery, there can be potential complications. With the sleeve gastrectomy, the overall complication rate is quite small. In about 1% of patients after sleeve gastrectomy, where we cut the stomach to remodel the stomach, that wound in the stomach can sometimes open up and cause various problems that may require further surgery and a prolonged stay in hospital. However, in 99% of patients, this operation will go quite smoothly and will help them to lose weight quite successfully and dramatically.
So really a very low complication rate.
That's correct.
How is a patient having had sleeve gastrectomy followed up post-operatively?
Generally, with all forms of weight loss surgery, we follow the patients up for many years. Excess weight or morbid obesity is a chronic condition, just like diabetes or high blood pressure. It is not a condition that we offer a magic fix that goes away in one or 2 minutes. It's a condition that we follow up over a lifelong period. So generally after weight loss surgery, we do tend to see people regularly just to make sure that their weight loss goals are being achieved over a lifetime.
Are there major changes in lifestyle for a person having undertaken this type of surgery?
The sleeve gastrectomy is becoming much more acceptable as a weight loss procedure over the lap band, in that after sleeve gastrectomy, the patient can still continue to eat fairly normally and does not require major modifications in their lifestyle. However, I often do tell patients that they do need to watch their diet and maintain an active lifestyle so that their weight can be maintained, as surgery is not a magic solution for all their weight problems.
And in terms of the surgical intervention itself, what could a patient expect in terms of recovery post-operatively?
Sleeve gastrectomy, like other modern weight loss surgical procedures, is done by keyhole surgery. So generally, this is the most minimally invasive way that we can achieve surgery on patients. Generally, the operation lasts for about 1.5 to 2 hours, and most patients will be out of hospital in 1 or 2 days after the procedure and back to their normal work in about 7 to 10 days after surgery. However, everyone does recover differently to surgery, but that is a general guide to the time frame of recovery after sleeve gastrectomy.
You have, I should say, told us about post-operative recovery and lifestyle. Is there a prelude to this type of surgery? In other words, would you suggest, for example, that a patient might seek even psychological advice prior to undertaking this type of treatment?
Generally, most surgeons that offer weight loss surgery will work in a multidisciplinary environment. This means that to achieve the weight loss goals, surgery is just one aspect. And generally, most surgeons will refer their patients onto their dietitian and psychologists and possibly an exercise physiologist in order to help them maximize their chance of losing weight as part of a more holistic approach to weight loss rather than just the surgery itself. So yes, many people are involved in the weight loss journey.
That's excellent. For the general practitioner, can they play a role, a particular role in recognizing patients that might absolutely benefit from this type of surgery?
I think the general practitioner plays a vital role, as morbid obesity is a very common problem in our society. I think that after various conservative measures such as diet and lifestyle modifications, I think the prospect of surgery should be discussed with the patient as a possible option for patients who are overweight and have been struggling with trying to lose weight and are developing significant problems from their excess weight, such as diabetes, joint problems, and heart problems.
Ken, one more mainly of interest to me question, if I may, and that is there an age profile for a patient presenting with this? In other words, can young people be dealt with using this surgery?
That's a very interesting question, because we know that adolescent or teenage obesity is a very significant problem. We know that overweight teenagers will turn into overweight adults. And currently, weight loss surgery is being offered for very young people, as it is perceived that they may actually get a longer benefit from their surgery and intervention at that earlier age. In the other end of the spectrum, we will also meet very active and elderly people who actually have a lot of years in their retirement and they want to maintain a very active retirement, and therefore weight loss surgery may also be of benefit to the other end of the age spectrum as well.
Thank you very much.
Thank you.